Hey guys, hi.
Hi.
How are you doing? My name is Kamila Bakirhan. I'm one of the medical oncologists here. Just really excited to talk to you guys about cancers in general and specifically colon cancer. I think it's a combination of people that I've known in my life who've had colon cancer, and I just wanted to know how I could help people like them in future. Plus, I think just the science of it, being really, especially in the last 20 years, I think cancer management has evolved so much, with targeted therapies, immunotherapy. So that's what I think drew my attention. I think the most recent one is the circulating tumor DNA. It's not available yet for clinical use in clinic. It's something that potentially may be helpful in future to detect cancers early on before they show up on scans, but also in management of patients who have cancer, manage their cancers. That all chemotherapies are the same. There are many different cancers. The management varies greatly, so the side effects differ. So if you've known somebody who had cancer and had a good or bad experience, doesn't necessarily mean this is something that you or your relative will have to deal with. So it's always helpful to ask all those questions about possible effects of chemotherapy from your oncologist. One thing that I wish people knew about cancer treatment is that it can be and oftentimes is curative. The most common piece of advice that I share with my patient is one day at a time. I think is what I probably say a lot, and really it has to do with a lot of overwhelming information that patients receive and really not being able to see the end to this or knowing how to handle a lot of appointments. And I think it helps to just take a deep breath and take one moment at a time. A small habit that makes a difference in health is probably staying hydrated. Yes, it's hard, but it's definitely doable. Yes, I get that question a lot. Colon cancer is on the rise, especially for those who are age 50 and younger. It is also associated with higher mortality rate in those patients. So for that reason, now all the guidelines agree that colon cancer should be screened at a younger age of 45 as opposed to 50 before. And of course, there's a family history of colon cancer, and then that age could be even younger. Right, so there are modifiable risk factors such as eating no processed food, high fiber, low fat diet, exercising, healthy body weight is associated with a lesser risk of colon cancer. The symptoms of colon cancer are irregular bowel movement, change in bowel movement habits that persist over a course of several weeks, blood in the stool, dark stools, abdominal pain, and unintentional weight loss. So if any of these happen, and especially if they're persistent, please do talk to your primary doctor. They should stay calm because a lot of it is usually not related to cancer, but absolutely address it with your primary doctor. I would recommend scheduling a follow-up visit, not waiting until annual physical to address these symptoms. Bye guys, thanks for coming. Hope it was helpful.